can we have a discussion about SUDEP? And during that discussion, can someone comment on a link or trouble using medical marijuana or any benefits with SUDEP?
So I can start off here. So SUDEP basically, it's an unfortunate but a very rare outcome of epilepsy, and so it stands for sudden unexpected death in patients with epilepsy. It's an unexpected, unwitnessed, usually death that is not related to a prolonged seizure and not related to drowning or accident, and usually happens during sleep. About 80% times these patients will die in their sleep, and the presumption is they probably had a seizure and then they stopped breathing after that. And after the seizure was over, they never started breathing again. That's the presumption of how SUDEP happens. Now, what causes SUDEP? It's a very complicated, issue. There's a lot of risk factors. The biggest risk for having SUDEP is if somebody has what's called a generalized tonic-clonic seizures or whole body shaking type seizures. And if those are happening at least 3 times every year or more, if somebody has seizures 3 times a year or more, their risk of having SUDEP is about 15, 20 times higher than others who have less than 3 seizures a year. And we're talking of generalized motor seizures, whole body type of seizures. The other risk factor is if somebody is on 3 medications or more. So if somebody's seizures are very well controlled, they're on only 1 medication or 2, their risk of dying suddenly is extremely low. But if their seizures are very uncontrolled, they're still having seizures and they're on 3 medications or above, then the chance of of having SUDEP is about 8 to 10 times higher than somebody who's on very few medications. The other risk factors would be if somebody has seizures starting from early age, like childhood epilepsy, or if somebody has developmental delay, low IQ. Those are all high risk factors for SUDEP. Patients with sleep disorders, possibly sleep apnea, may also be a risk factor for SUDEP. Now, coming to the second part, the medical marijuana, I don't think there is any evidence, at least in my knowledge, of that either helping or making it worse. But we do know from literature that cannabis can actually cause seizures or induce seizures in somebody who has epilepsy. And so with that risk of having a breakthrough seizure from cannabis, the possibility of having an adverse outcome like SUDEP is theoretically increased. I don't think it's otherwise. I don't think cannabis will reduce the risk of SUDEP.
So each of us have different experiences. So coming to the first point, so the practical point which I give to parents about SUDEP, that make sure when they go to sleep, their bed and the pillows are firm. Don't go for very soft pillows. The other thing, make sure they do not sleep with too many of the stuffed toys. That's another practical point. So and now they're coming back to, so my experience was that, so during my residency, one of a very important, I will not say the name, so very important child in the New York State literally died from withdrawal of marijuana in front of, I saw that case. So the major issue in marijuana is the withdrawal. Do not stop any medicine suddenly. In that kind of situation, what happened at that time, CBD oil was not legal in the New York State, and people were using it just without letting anybody know. And eventually, when they ran out of them, there was no supply. So make sure if you're taking CBD oil or marijuana, so don't stop it immediately, because stopping it will be a bad thing. Like, don't stop cold turkey. That's what I want to say.
I would say I agree with Dr. Sheikh as well as Dr. Mahfouz, but the SUDEP's a big area of research still. We're still trying to figure out what exactly causes it. I think the biggest risk factor is generalized tonic-clonic seizures, frequent uncontrolled generalized tonic-clonic seizures. The other risk factors mentioned, like taking a bunch of meds, cognitive disability, MRDD, all of those are also associated with increased seizures, which is, like a risk. So it's hard to say what exactly is a risk factor for SUDEP versus what is correlated with SUDEP, because it's something that patients with frequent seizures have regardless. Patients with frequent seizures will be on 4 or 5 meds, which may not be helping anyway. That's all I wanted to add.
It's also interesting that are some epilepsy syndromes that are of particular concern. The best example, one that we can discuss with both parts of the question, is Dravet syndrome. Dravet syndrome is a genetic epilepsy syndrome, and the seizures are really hard to control. I have a couple of patients with Dravet syndrome that I follow regularly, one who's in his 20s, and he's having apneas already at night. And the risk for sudden death with Dravet syndrome is extremely high. So he has monitoring at night. He's lucky enough to have nursing supervision at night, and he's on an apnea monitor at night. So we're watching him very carefully. So there are syndromes that we have to be aware of. And the other part is the whole thing with medical marijuana is that there is one preparation that is FDA approved, and that's CBD oil, or Epidiolex. And that's been very well studied. And it's a purified derivative that's only CBD. And we have good data there. As far as other marijuana preparations, there's a lot less study that's gone on. And some of the things that are available over the counter, you don't even know how much CBD you're giving.
So Dr. Nagel, Epidiolex is only available by a prescription, correct?
That is correct. It's FDA approved for Dravet syndrome, Lennox-Gastaut syndrome, and tuberous sclerosis. And while it's not even, it's no longer regulated by the DEA. It's not even a category 5 anymore. So the DEA is out of the picture for Epidiolex. It's still regulated in a sense by the insurance companies, who will often not pay for it if it's not for one of the indications, or at least for an epileptic encephalopathy. It's very expensive, but so are the preparations over the counter. When you look at the amount that of CBD that we're actually prescribing for patients, an adult can be getting 200 to 300 milligrams per dose fairly easily.
And I have a question. Sorry.
Sure.
I have a question from Dr. Nagel. So other than this syndrome, which we know they are FDA approved for medical marijuana, but we often come into clinic with situation when a patient has other syndrome, and patient also has autism, severe behavioral issues, and we want to prescribe marijuana, but we get a pushback from insurances. How do you deal those situations?
Usually on peer review, I have found of late that if I freely admit that it may not technically be Dravet syndrome or Lennox-Gastaut or tuberous sclerosis, if I say that this is a patient with an epileptic encephalopathy, that will frequently get the approval. So I think when I look at this, there was a very good insight from Dr. Kodegal from Cleveland, that he thought it was very interesting when it first came out that you had Dravet syndrome, which is a very specific genetic diagnosis, with 90% of the cases being due to a very specific mutation in one gene, which is SCN1A, whereas with Lennox-Gastaut, there are multiple causes of Lennox-Gastaut syndrome. So if you switch the terminology to epileptic encephalopathy, that will often get people to go along with that, with the certification for it.